Hi, everyone. We're going to be starting shortly. We hope you're as excited as we are. We're just going to give people a couple more minutes to join. We'll be right back. Good afternoon, everyone. My name is David Block, Physical Therapist and Regional Director at Spear Physical and Occupational Therapy. I'd like to welcome back those of you who have attended one of our other webinars, as well as welcome those who are joining us for the first time. Thank you all for choosing to spend the next hour or so with us. We appreciate you taking time out today to learn with us. For those of you who don't know who we are, Spear is a private outpatient practice that has been around for over 20 years, with currently 20 locations located all over the New York City metro area. Some exciting news for us: this past weekend, we were recipients of the National Physical Therapy Practice of the Year Award. We've continued to offer in-person care through the COVID-19 pandemic, and we are strategically going above and beyond the CDC guidelines to ensure the safety and well-being of everyone within our clinics. For detailed information on the safety measures we're taking, please visit our website, www.spearcenter.com. Also joining us today are our partners at Athletes Warehouse. They are a sports performance center located in Pleasantville, New York, which houses our Spear Pleasantville Clinic. Their team specializes in sports performance training, both in person and remotely, for athletes of all ages. For more information on the team, please visit athleteswarehouse.com. As we've slowly begun to return to our pre-pandemic activities over the last several weeks, we've noticed many people have tried to pick up their activities right where they left off, which has led to some pain. In particular, we see this challenge with overhead athletes who participate in sports like baseball, softball, tennis, and golf, to name a few. Our team of therapists and coaches got together and agreed that given today's challenging circumstances, it would be a good idea to provide you all with some tips on how to both prevent and address any symptoms you may be currently experiencing as you get back into the game. We created today's talk specifically for you and are coming to you live from our own homes. We don't anticipate any technical issues today, but please be patient with us as we navigate working through this technology. As part of this session, we'll be demonstrating some exercises, and we really look forward to having you follow along and participate. I promise this won't be your typical Zoom meeting. We're going to have some fun. Please note that if you experience any pain while performing any of the exercises that we demonstrate today, please stop and reach out to us directly so we can support you. Before we dive into the webinar, I just want to go through some housekeeping things. I mentioned we want to hear from you throughout the webinar. If you have any questions, please feel free to let us know your thoughts in the Q&A feature. To find where that is, please take a moment to hover your mouse at the bottom of your screen. You will see a Q&A option pop up. That's where you're going to put your questions today. We're going to do our best to address as many of them as possible throughout this webinar. It's best practice to put questions in the Q&A so that we can answer them promptly. If you put questions in the chat feature, we will likely be unable to answer them during the webinar. For those of you who are watching through YouTube Live, we're monitoring the comments section there as well, so please feel free to type your questions in. Lastly, there's going to be times throughout this webinar where multiple panelists are on the screen. For the best viewing experience, please select Gallery View at the top right corner of your Zoom screen. This will enable you to see multiple panelists at one time. So let's talk about our goals for the day and what we're going to be covering. Today, the first thing we're going to discuss is common injuries that we see in overhead athletes and how these injuries can lead to poor performance. We're also going to talk about how to rehab and prevent these types of injuries and demonstrate some exercises to increase performance when returning to sports. Before we get started, I'd like to introduce our team of panelists. We're going to welcome everyone on the screen now. So as I mentioned before, at this moment, you should be able to see all the panelists on the screen. So please make sure you're in gallery view. Again, that's at the top right corner of your screen, and select gallery view. That will enable you to see both Nick and Kyle throughout the webinar. So without further ado, first up, we have Kyle Stupi. He's a physical therapist and clinical director at our Westchester Pleasantville location inside Athletes Warehouse. With him, we have Nick Serio, co-founder and general manager at Athletes Warehouse in Pleasantville, New York. Kyle and Nick are actually broadcasting in different rooms at the Athletes Warehouse spot. Lastly, we have Michelle Deerwater, who's a physical therapist and clinical director at our West 75th Street location, and she'll be helping us answer some of your questions in the Q&A. All right, Kyle and Nick, we'll let you take it away. Michelle and I are going to say goodbye for now.
Thanks. All right, thanks a lot, Dave. And hello, everyone. Thanks for taking a few minutes to join us here this afternoon. So as David alluded to, over the last few months, we've seen a lot of our patients and athletes return to the sports that they love, which honestly is music to our ears. There's nothing we love more than seeing people get back to the work that they love to do. It's the reason why we do our jobs, is that everybody can get back in. Given the nature of the pandemic, so many people have been holding off from their sports and recreation over the last several months. And now, thankfully, that we're able to return to some of those activities, we're starting to see some people come into our offices here with some injuries and things like that. One of the most common mistakes we see with people returning to their sports is returning too quickly. Athletes in particular have such a tendency to take a mile when they're given an inch and go from 0 to 100 miles an hour right out of the gate. We have baseball players throwing full speed, trying to increase velocity or velo, just like they were in the spring. Tennis players are back on the courts for 3 hours a day after not being on the court for 6 months. Golfers doing 18 or 36 holes a day. Lacrosse is kicking back up. We've seen all this stuff, and we're starting to see some people come into our offices with some injuries. And when the body takes some time off from the high-level activities that we're used to doing, tissues, muscles, ligaments, tendons all go through some changes, and it takes some time to build back up. It takes time for the brain and the muscles to reconnect and reestablish that reaction speed. The ligaments tend to get a little stiff, as do the muscles and tendons, which can lead to some injuries if they're not taken back properly. So a lot of the supporting muscles around the joints, we want to get them stronger during this time and get them prepped so that we can go back to the sports that we want to do and do them safely. All these things can lead to decreased performance as well as injury, and that's what we're going to talk to you guys a little bit about today. So before we get a little further in, Nick, we're going to head off with some talking about some of the things you're seeing on your end with some of your athletes.
Yeah, Kyle, thanks so much. And I want to first reiterate your sentiment there that Athletes Warehouse, I mean, we're built on athletes, right? So when we can get to see them actually go back to sport, it's one of the greatest times ever, especially over this pandemic, watching some of these young individuals go through most depression-like states, not really sure what they should be training for and how, and even why. They lost some of that why. So that's really damaging to a young individual like that. So getting to see them back playing now has been one of the greatest things. Going over another one of your statements there, and I want to reiterate it again, is that the 0 to 100, right? And you sort of hit on it a little bit in terms of from brain to muscle, but really what we're referencing there is like the nervous system, right? And how that's going to interplay with kinematic sequencing. So when we're talking about kinematic sequencing, right, let's just break that segment down even further, and let's talk the coordination of a movement. Right. So when I haven't done an action for, let's say, 2 months, 3 months, some of my brain mapping on how I did that, right, the motor ingram in my brain, the blueprint of how I make that movement, it's sort of lost. And when I lose some of that, I tend to then create a different one or revert back to a poorer movement pattern. And I open myself up to these differences in terms of, let's say, an arm slot for a pitcher. When I'm serving a tennis, I might, a serve, I might be a little off on how I'm doing it. And then Kyle, which you also mentioned, is the length of time we're doing these actions, right? So even if I can keep my kinematic sequencing in check for the first, let's say, 10 minutes I'm doing something or whatever it might be, when I stretch that over, hey, I haven't been doing this for 3 months and now I'm going and playing a game where some of our pitchers are expected to now all of a sudden go and pitch 3, 4, 5, 6 innings. It's a recipe for disaster, absolutely. And it's an unfortunate thing. And, it's a difficult time, right? Because no matter how much education we do on that topic right now, there is still the fear of, COVID-19 and transmitting that. And so it is difficult sometimes for people to get those practice and training opportunities in, but I'm hoping that's what we can really provide for today.
Awesome. So we're going to take some time here. We're going to go over some basic injuries on our end, and then Nick's going to talk a little about the performance declines that they're seeing as well. So we're going to start. We have 3 different areas I'm going to go over here. I'm going to go over first the head and neck and back. Seems a little silly when we're talking about overhead stuff. We're thinking about the arm itself being overhead, but obviously the neck and back have a lot to do with it. We've had some previous webinars speaking about posture and working from home as it relates to neck and back pain, which if you're interested, you should definitely go on our channels and check out. But in terms of the overhead athletes, these structures are the foundation of a lot of the muscles that contribute to the sports that we play, in particular the rotator cuff muscles around the shoulder, which we'll talk about in a minute. They're attached to the shoulder blade or the scapula in the back. So with poor posture, where we're kind of hunched over like this and our heads are up, we're all typing on our computers all day or on our school Zooms and trying to check those out, our shoulder blades can get off on a bad start and get in a bad position. If your shoulder blade's in a bad position, it's going to put the rotator cuff in a bad position, and it's not going to allow the rotator cuff to do its job. Same thing goes to the neck. There's necks being protracted and flexed up like this, like we're looking at computer screens all day, or even down like this, which I'm just as guilty as anybody else, checking my phone or doing computer work around the clinic. Definitely has a pull the neck muscles, including the levator and the trapezius muscles, 2 of the main muscles that are in the area that are involved in overhead sports. So let's take it down a little bit. Once we go back from the neck into the shoulders, we're going to go into the rotator cuff. So the rotator cuff itself has one primary job. It's to keep the ball within the socket at all times. Wherever it's lifting, whether it's throwing, swinging, carrying your bag, whatever it is, the idea of the rotator cuff is it keeps it in the socket at all times. The rotator cuff's also heavily involved in overhead athletes, in particular with throwing and swinging, as it's the decelerator as your arm comes down. So as the arm comes down from a throw, lacrosse coming across, tennis serve, you name it, the rotator cuff muscle's job is to keep that arm in the socket and to slow the momentum of it down. And that's where a lot of injuries happen at this time. The big reason why is that the rotator cuff itself is something that we don't tend to focus a lot on in the strength programs, or even at all when we're not strengthening, and then you get a heavy dose of it when it comes to returning back to the sport. So that's something we're going to go over in a little bit in terms of the exercises. We see a lot of tendinitis come from it, which comes from overuse or overstrain of the muscles, and it usually takes a few weeks to resolve. And when you're starting to come back, those few weeks can be precious, because I know we're all itching to get out there. Rotator cuff tears. Let's speak a little bit on that. Tears are actually fairly common in most people. The rule of thumb I always tell my patients is take your age. That's about the % chance that you probably have a rotator cuff tear in your shoulder, whether or not you know it. The good news is most people are asymptomatic, meaning they don't feel anything until you do something that causes you to feel it, like head back to your sport too soon or try to do too much too fast. So we want to keep it that way. So keeping that rotator cuff strong, and as one of our PTs in the field here calls it, keep it bulletproof. Not literally, obviously, but keeping it bulletproof is a huge factor in preventing any kind of injury to the shoulder, whether you're playing a sport or just going throughout your daily life. Last thing is elbows. It's a big issue in baseball right now with a lot of younger kids, especially with throwing. But we also see with shooting, swinging sports, particularly at the UCL, the medial ligament that's on the elbow over here. It's a huge issue with sports. We've seen a lot of it with specialization over the years, kids playing or adults playing one particular sport over the course of the full year and not diversifying up from the workout or from the sport too much. Specialization is something that Nick will talk extensively on, I'm sure, and something that we think is not necessarily a bad thing if it's done correctly, but it's something we want to keep wary of. So changing up those muscle patterns, not getting into that throwing position too soon, but also diversifying as you're throwing, getting in some different activities and still being able to keep that strength as you go along to keep in competition strength while still not putting all the joints at risk. So now we're going to talk a little bit about some of the problems we see with some performance related to some of these injuries.
Yeah, thanks, Kyle. One of the points you hit on there too was a lot of the computer syndromes, right? Those upper cross syndromes where we have the tendency to have our shoulders sort of protracted in this position and then a forward head posture. I just want you guys to think about something too. We deal a lot in youth athletes. And by youth, I mean ranging as high, I guess I shouldn't call it youth, all the way up to professional. But especially those that are in middle school and high school right now, I want you guys to take in mind, yes, they might be on a computer regularly when they get home from school or on their cell phone periodically while they're at school. Now, when they have to distance learn for an entire week, think about the amount of time that they're now spending on a computer and what that's doing to their posture, to their body's central nervous system, what the body is now getting adjusted to in these tight patterns, and then being expected to go out and perform in the same manner as it should or would have in the past. I'm not saying there's any direct fix to that. I'm just trying to make everybody a little cognizant of why we might see some of these injuries. Now, I know Kyle just went over some of the common injuries we see. What I really wanted to hit on for you guys was, how do I know when it is an injury, or really what's a bad indication of an injury, right? And a bad indication is pain. And why I'm telling you that that's a bad indication is you're probably already hurt and you probably already need, to be going to visit Kyle in some capacity at that point in time. And hopefully he can keep you away from the orthopedist at that point. But what are some other factors that we can look at as indicators of I might be headed towards an injury, or I might be headed towards an area where I am hurt? And one of those indicators is, without it, they're all going to be external, right? Because I don't want you to be focusing on what do I feel while I'm doing it. So a great indicator, especially if I'm a baseball player, if I'm playing tennis, I've even seen studies on it in volleyball. The human body is an unbelievable machine, and it will start to slow you down if it's afraid that it can't handle the forces you're producing. So one of the studies I'm referencing was volleyball athletes, and their serve started to go down. And what it started to indicate was that there was actual labral tears that they found in some of these athletes that were having no pain, but their serves were just dropping in velocity. We see this across the board in baseball athletes. Pitchers whose velocity all of a sudden drops from an 87 to an 82. We know there's likely some kind of issue going on in that shoulder or elbow that the body is trying to stop you from doing. Another one could be loss of control. So just not aware of where the arm is in space. As Kyle indicated before, the rotator cuff's chief responsibility is to keep the humeral head, right, the arm, in the socket, in that joint, and working congruently with the rest of the joint. So if all of a sudden my location or my accuracy in anything I'm doing is off, then that's a really good indication that I might have something that could lead to a massive injury. And it might be a good time to get that looked at ahead of time.
And Nick hit on a good point, talk about pain a little bit. Pain is something that it's so subjective, and some people are afraid to use the word pain because they say, well, my shoulder hurts, but I know what real pain is, and it's not real pain. Either way, that's your body's telling you exactly what Nick said of it's trying to send you a message. So being able to differentiate between that pain and discomfort line, but also listening to yourself. And if something doesn't feel right, if you're noticing, like Nick said, signs of your accuracy is going down, your velocity is going down, how you're feeling during the workout or how you're feeling during the sport is starting to be negatively affected, listen to your body. And one of the lines I tell patients all the time is, we're good at what we do. Nick is fantastic at what he does, but we can't feel what you feel. We don't know your body the way that you do. And that's such a key thing. So listening to the body is such a huge thing. And to speak a little bit more to avoiding big injuries. So thankfully, a lot of the stuff that we see, I'd say about half of our caseload are people who have not had surgery, believe it or not, and people who are coming to us with just little small strains and things like that. That's relatively easy for us to fix. Get the right muscles to turn on the right way, build up some strength, retrain the mechanics, and people can go back to their sport in a matter of weeks as opposed to months if you have surgery. The negative part is you get a lot of people will say, well, I felt it a couple months ago when I was doing something. I took a little time off. It felt better. So I went back out and did it again. And it came back with a vengeance. And it's a lot worse than it was before. That's when we start getting into trouble, because that's when something can happen where you maybe cause some more long-term damage to the joints. Those muscles in the rotator cuff, if they're not kicking in correctly, they can lead to some impingement syndrome in the shoulder. They can lead to the rotator cuff tear, which we talked about, even some bone spurs underneath there, which can be way more damaging in the long run. So the big overarching message here is keeping that pain to a level that is comfortable. It should be a discomfort, not a pain. But if you do feel pain, listen to your body. Listen to all those telltale signs. There's a lot of research. Nick was talking about volleyball. There's another one that I want to reference for baseball players, in particular for pitchers, is your hips should be square around to the third base as you're going through. As guys get tired, those hips just start working their way down the line, and the hips start to take over and creating more whip on the shoulder as it goes along. And that just leads to more injuries, in addition to the velocity going down. Nick, any other indicators for things that you've seen along the way?
No, I mean, what I would say too is sometimes, especially in the baseball realm, right? You pretty much establish pain is going to be somewhat a part of your game. Specifically speaking to pitchers, right? You're going to have some level of discomfort after a throwing event. And I think oftentimes we get a little confused in terms of, what's soreness and what is pain and when should I go get it looked at and da-da-da-da. And I think some of the things we want to be careful of when we're referencing a lot of those different situations, and I can speak specifically to pitchers, is, anything really lasting past that 2-day mark after your performance is probably not a good indication of something that's just soreness. We really want to pay attention from a pitching standpoint to anterior, so front side shoulder pain, or forearm tightness. Those are two areas that are generally like the kiss of death for a pitcher, where you're heading down a path where it may not be salvageable in those situations, because really those two areas are taking over a lot of the brunt of the forces going through the actual action. So just two areas that I would really pay close attention to if I'm really concerned as to whether something is soreness or pain.
Yeah, absolutely. And to touch on a little bit, let's step away from like the baseball and volleyball and athlete world for a second. One of my favorite things I like to tell people is everyone's an athlete, whether you play a sport or not. My sister-in-law has 3 boys and they're 5 years old. Chasing after them, she's as much of an athlete as any of us are. So having to pick up the kids, reaching, playing, things like that. If it's an activity that you normally do without pain, whether it's writing, typing, reaching into that top cabinet, carrying the kids, whatever it is, if something doesn't feel right, that's your body trying to tell you something. And that's some stuff that with a couple of simple exercises and some things that we can go along can certainly help out quite a bit in that realm. All right, so we're gonna go through a couple of exercises with you guys. We have some things prepared. I'm gonna speak a little bit more towards some of the some weights and some things that can help with some shoulder and some elbow care specifically. Nick's going to help out. He has a resistance band, so he's going to demonstrate exercises as I talk here, so you guys can see and listen at the same time. If you don't have resistance bands or you don't have any weights at home, not a problem. We're going to send a sheet out with some alternatives, but also Nick is going to go over exercises as well that aren't going to be weight dependent or resistance band dependent. So don't worry if you don't have any of those at home.
They could probably also isometrically hold the position too and feel
exactly. It. So just going through the position itself is something that can also be done as well. All right, so the first thing Nick is going to demonstrate for us is one of every PT's favorites called no money, some people call it, or bilateral external rotation. So what he's got is he has his elbows pinned to his side right there. He has a band in his arms with his hands by his side. And all he's going to do is he's going to pull his arms apart. Hey, honestly, Nick, if you can step back, that's perfect. Good. He's going to keep his elbows tight to his side. He's going to pull apart like that, holding it for a second or two at the end, and then bring it back in nice and slow. So we're going to talk about speed of the movements here for a couple of seconds. So when the band goes out, we're going into the concentric phase where the muscle's getting shorter. As we release it and as he comes back in towards it, we want to go really, really slow through that activity. That's where the most muscle force is produced, is through that motion. I think everybody's done a bicep curl at one time where they curl up and down like this. We all know it's a lot harder to go really slow on the way down because of that same exact reason. There's a lot of force being generated. So when doing these exercises right here, we're really working those rotator cuff muscles, getting them to fire. I love this exercise because it's so simple that you can sit at your computer honestly and do it while reading your emails or checking things out. And then for athletes, this is a great warm-up exercise to do as you get ready to do something. I'm a big fan of what's called pre-fatigue, where you take the muscle through and you actually work on the muscle that you're trying to target ahead of some of your bigger motions, so that you get the brain and the muscle to work on the same page, and that muscle's already got some blood flow in there and it's already working at full speed before it gets into the heavier stuff. Think like bench press or push-ups or even throwing or things like that. So the next we're going to go through is it's called a D2 extension. So what Nick's going to do is he's going to stand on a band one end with his foot. And then with the other side, what he's going to do is he's going to take the arm starting across his body and then come up and across the opposite direction, just like he's doing right there. So as he starts across the body, this is a great motion because it's what's called triplanar, meaning it's going through 3 different planes of motion. He's going from bottom to top. He's going from across his body to away from his body. And if you watch his thumb's actually starting towards his hip and it's finishing away from his body. So his shoulder is going into a full rotation, which is also going to help out with that rotator cuff. One of the big things that we want to prepare athletes in is you want to get into the position that you're going to be in for your sport. If you're an overhead athlete, if you serve a volleyball, if you throw a baseball, if you golf, we want to get you into that overhead position. If you never train the overhead position, you're never going to be strong in it. Even if we're doing the same muscle work in different fashions, it's got to be in the same position that you're actually doing the exercise in. So this is a great exercise as well. And like Nick alluded to, it's fine to do this without a band if you don't have one. It's still going to create a good bit of fatigue. Or if you have, I've been telling people at home with the telehealth services, soup cans are just fine to use as well. So there's some small weights that you might have around the house. The next one he's going to do is called a horizontal abduction. So Nick's going to have the band right in front of his chest with his arms straight in front. And all he's going to do is pull it across nice and slow until it touches his chest. And again, the important part, going nice and slow in the recoil, we shouldn't see that band do any kind of fraying up and down as he goes along. Big indicator here, we talked a little bit about the shoulder blades in the back. You really want to squeeze those shoulder blades and really kiss them back there and try to get them to touch. Thanks, Nick, for turning around. What that's going to do is it's going to help put those shoulder blades in a great spot and keep those rotator cuff muscles in a good position to be able to do their job of keeping that ball into that socket. Again, this is a great one I like for pre-fatiguing or working a muscle before you're actually going to go into a bigger motion, so you can target it a little bit and get it to fire more correctly. And again, this is a good one you can do just, again, sitting at the computer during your Zoom meetings if your camera's not on or if you're working from home, again, to get those shoulders going. The last one we're going to do is, again, we're going to train overhead. So what Nick's going to do is he's going to take the band up over his head. It's got a little bit of tension on it. And as he brings the band behind his head, he's going to spread his arms apart and squeeze those shoulder blades in back. This kind of brings together a lot of the concepts we were talking about. We're in an overhead position, so we're training that motion. He's going to do a really good job of squeezing his shoulder blades behind him so that they get a nice kiss and so that they're in a great position for the rotator cuff and really work on those. Again, a good position and a good exercise to do if you're sitting at home, minimal exercise, anything needed for that. So the last thing I want to wrap up my portion with is a little bit of a talk on the core. And Nick's going to get into this a little bit with some of his exercises. I went to a continuing ed course a few years ago, and one of the surgeons who works with one of the Major League Baseball teams had a talk on elbows and elbow injuries. And he goes, I'm going to start this talk where nobody thinks it's going to go. We're going to start with the core, with your abdominals. And everybody kind of shook their head like, what's this guy talking about? And it was a great presentation because when you're talking about an athlete that throws overhead, what we do is we generate our force with our lower body. And as we step through, all that force is being generated with the legs. It's working its way up through the core, into your shoulder, and eventually out through the ball in your arm. Even if you're just in the backyard playing with the kids, it's the same idea. All that force that's generated with the leg has to have a strong core to go through it to get through the arm. If the core is not strong and holding into a good position, all that force has to be regenerated by the shoulder and elbow. And that's, again, the kiss of death. You're looking at injuries right off the bat if you're losing that. So being able to have that good core strength is a key element. Things like planks, things like bird dogs, things like presses or twists, all of those are good to do. Of course, if you've been cleared by the medical personnel to do so, or you see one of us, Nick or myself and any one of our teams can go over that with you to show you a good core program but definitely something to keep involved as you go through the progressions.
Awesome. Kyle, really cool. So guys, what I want to do is now reference what would I be doing if I was getting ready to go to an actual performance element right there, and I have to get warm for it. And the reason I want to talk about this is really what we indicated earlier, right? So I had come, and I'm going to try and bring it full circle here for you, is I thought, and in my opinion, one of the leading causes to having a lot of these injuries occur, and I mean, we're seeing, look at the NFL, they're littered with injuries right now, and a lot of it, with reference to the kinematic sequencing, right? Which at the end of the day is really how well prepared is my central nervous system for the demands that I'm about to apply to it. So I look back to, at this point in time now, what does my warm-up look like? And I can tell you wholeheartedly, having worked with young athletes for the last 12 years, they give about zero attention to a warm-up, and their only interest is in, hey, let me get to the game, which I can respect and I understand, but here is the message I'm trying to give you, is that you haven't had a warm-up or a game for 3-4 months, and now you're going to go and try and go all out. It's not going to end well. So let's pay a little more attention to our warm-up, and some of those things that I'm talking about in there. When you're thinking about your warm-up, you want to start slow and end fast, right? The ultimate objective of a warm-up is to do similar type movement patterns to what I'm going to do in a game, right? So that my blueprint starts to get very well prepared. And I want to start those motions off slow and very global and work to very fine. So what do I mean by that? Well, a slow global movement might be something like a squat or lunge, right? A working to more refined movement might be a single leg hinge or a single leg jump that you might be emulating like in the actual game. One of the movements that I can say wholeheartedly, any team that I'm coaching, any athlete I'm working with, you're probably going to see them crawling. Reason being, you're getting the cross crawl patterning, just like we do when we run, right? Left arm, right leg moves. Well, on a bear crawl, you're going to have right arm, left leg, same movement patterns that you're going to be doing in a game. So you're getting that cross stability, talking about that core symmetry that Kyle was talking about. We're going to get a lot of that involved when we're actually doing this motion. And then when we flip the exercise and we take it to a reverse bear crawl, we're now actually getting into that overhead position as we're moving back. So hence bringing it full circle to our overhead athletes here. One of the greatest exercises you can do at home and also before a game is either a bear crawl or a quadruped rocker, which is basically just being in that bear crawl position and trying to touch your butt to your heels and then move back forward. Okay, these actions are going to get your body into that overhead position with next to no load, right? It's just your body weight as the load, and it's a marginal section of your body weight that you're actually experiencing or expressing at that time. So these actions will help not only prepare you mentally in terms of your central nervous system and your neuromuscular system, but it'll also prepare you from a getting hot and blood flow and sweat type mentality. Anybody who's done a bear crawl over 25 yards knows they're sweating, they're breathing heavy, and they're exhausted at the end of it. So it's a perfect primer to get you out there onto the field, no matter what sport you're playing, field, court, doesn't matter.
Awesome. So we're gonna bring Dave back here in a couple of seconds. He's gonna help us go through some Q&As. Again, if you guys have any Q&As, please feel free to put those into the Q&A section at the bottom and into the chat section over on YouTube if you're listening over there.
And I love being the moderator on these. I always learn a ton, and you guys are great and in sync. And I'm really excited to get through some of these really good questions that we have coming in. So we'll start with a question from Nick. Nick wants to know, since the pandemic, he's been doing a lot of walking and running. He also plays golf. He gets pain in his shoulders every now and then and wants to know if excessive running or walking can cause this pain. He's in pretty good shape.
I would say absolutely. When you're doing excessive walking or running, I'll turn myself a second here. So if you're going through this motion with the arm, you can see the arm is going through a good bit of motion right here. And a lot of us being sitting at home or at desks these days, we're in that rounded shoulder position. So if you're rounded and then you're going through this motion, can pull a lot of force and a lot of shear onto that front part of the shoulder, which can work into some of those impingement type syndromes that we see. So it's definitely something to keep cognizant of. So Nick, I would say definitely keep an eye on your posture, whether you're sitting at home or while you're running, and while you're returning to sport as well. And then work on those shoulder muscles as well to get those in good shape.
Nick, do you have anything that any tips you'd add in on that?
Yeah, just reiterating on the posture end of that, I would obviously watch to see where our neck is during that running, and then also breathing, right? So when you're talking about, hey, your shoulder is hurting, all right, our breathing is controlled a lot, obviously, by our rib cage, right? And our first rib can run up and start to jam right up in here, right underneath our clavicle. Can start to jam a lot of the nerve endings and arteries and tracts that we have heading down there. So I would really pay attention to how your breathing is patterning while you're doing that, and trying to really control your rib cage from moving around a little bit too much there. Yeah.
Thanks, Nick. Thanks, Kyle. Next question. I think this one's directed more towards Nick. So Nick, could you make more specific suggestions for pre-fatiguing for tennis? Or do you have any other suggestions?
Yeah. Well, listen, pre-fatiguing for tennis, right? So we're going to talk about two different areas that might be one that's very similar to, let's say, every overhead athlete, and then one that's probably not. So one that's going to be very similar in that essence is the necessity to get overhead, right? So to get warm in that position. Some things that I would do too is don't be afraid to simply go into the position, even if you're going to go into a lunge, and just pattern that while controlling where your ribs are going, and just literally holding into that position like that, but actually feeling your scapula, right? That shoulder blade muscle be the thing that's bringing the arm up, and not your deltoid. If your deltoid, right, your shoulder cap right here is the object that, or the musculature that you feel working, bringing that up, we know that we're going in a wrong pattern with that. We really want to feel that action back in this range, back down in here, with some of that muscle that's pulling the scapula up and around the ribs. The second point would be the fact that there's a lot of external rotation from back arm shots in tennis. Yes, similar to a baseball aspect, but not as much concentric, right? We have to remember when we're going into that in a baseball patterning, the arm is really off. When we're going into it in a backhand on tennis, we have a lot of concentric action that's going into that. So you can do what's called eccentric liftoffs. So you can be in this pattern right here. If you could, and I'm assuming you can all see me, there was a pole.
Hey, Nick. Nick, if you could just take one step a little further back, I think that's perfect. Perfect.
Okay. So if there was a pole that I'm resting my arm up against, I would have this angle. So if you can see my angle, I'm like at 35 to 45 degrees away from the pole, so that I'm in the line of the scap. And then I would pull back with my arm, touching my elbow to the pole. What that's going to do is it's going to light up what a muscle called your infraspinatus, right? Which is your primary external rotator. It's also going to start to hit your teres minor, teres major. These are some of those rotator cuff musculature that Kyle was referencing earlier. Once we're turning those on, they're now very primed for any action we're going to be doing later in that event.
Awesome, Nick. You are a smart guy. I'm very happy to have you on this panel. So you mentioned external rotation with a backhand in tennis. And we actually have a question. Kyle or Nick, I'm sure both of you have some input on this. Steven wants to know, how much external rotation in the shoulder should there be?
I'll give Nick a breather for a second on this one. The unofficial answer to that question is as much as the person can do and be comfortable with. When I look at people, I'm not necessarily looking to get to a certain degree mark per se with external rotation. I look more for the quality of the movement that somebody does have, and that they're as strong at 0 degrees as that they are at as far as it can possibly be. So one of the exercises we demonstrated earlier was with the external rotation with the elbows by your side. If you have some kind of band or something to get the arm, kind of what Nick was alluding to, up in this position.
Hey, Kyle, sorry to bug you. Nick, do you mind demonstrating one more time while Kyle does this, just so that people at home can check it out?
Right. So Nick has his elbow up and about 90 degrees away from his side there, and he's going through that same motion. Now, Nick, bring that elbow down about halfway, and then do the same exact motion. rotation in and out, rotation, there you go, and then bring it all the way to the side. It's all the same motion, but that rotator cuff needs to be as strong in all of those positions. So to answer the question, I would say it doesn't necessarily matter from a number perspective as much as it matters from a, hey, am I as strong at 0 degrees as I am at 90, as I am at 45, etc.
Awesome. Thanks so much. Great question, Stephen. So we have a couple questions on posture, but I want to just switch gears a little bit before we get into those. Jan wants to know, to what extent are these considerations applicable to other areas, like playing the piano, for example, or playing an instrument like the cello?
Yeah, I mean, Kyle, this is definitely your wheelhouse, but I mean, I'll just throw something in there. In this essence is that anything you're doing to get any of these motions that we're talking about, remember, these actions are human movements, right? We're expected to do these actions at any point in time throughout our day. We only ruin them by thinking about just what they can do for a baseball aspect. But when we're looking at movements that humans can do, these are all part of them. We need to live in all these planes at all times because that's what life is.
Absolutely. I mean, athletics and sports are just extraordinary examples of human performance. Anyone can do this with their arm or throw a baseball in the backyard with the kids, but to do it at a high performance level, it's just the same thing with a higher performance. So to answer the question, I would say in terms of posture, it's paramount with everything that we do, whether we're sitting in front of a computer, playing piano, or playing any instrument, sitting at the dinner table, standing and doing a Zoom call in front of a bunch of people. Getting those shoulders to come down and back, like we were emphasizing in some of the exercises, to really work on that and to really get that head back as well. So a lot of us tend to be forward here. I'm just as guilty, but to bring that head and shoulders back with a nice proud chest is an important position to be in. I have a patient now, he works in a lab and he's kind of hunched over like this, working with science materials, just that's what his job is. So it's the nature of the job that you're going to be in certain positions or activity that you're going to be in certain positions that aren't as good. It just is all the more important to, again, get back into that position here. And I do believe we have a posture specific webinar that we did a few weeks ago. So I would also say to go back to the YouTube channels as well and check that out for some more specific information on posture.
Kyle, are you cheating and reading ahead in the Q&A? You got the next two questions lined up right for you perfectly. So we have a couple that are in the same realm, and I'd love to hear from both Nick and Kyle on your philosophies on this. We have one question that asks, any advice on it, any advice or exercise for the head anterior tilt? So I think someone's referring to that forward head posture you were just referring to, Kyle. And the other question on forward head posture is someone that says they have visibly tight upper traps. What are some things they can do to start correcting that?
Nick, I'll let you take the first one.
Head and neck posture or the trap?
Either or, I'll take the other.
Okay. Generally, so when the trap is going to be over dominant, right? The trap is really supposed to be responsible especially when we're talking, I'll keep it to our overhead positioning, right? It's really supposed to be responsible at 120 degrees and higher. What we tend to see is that when we get athletes or when we get just individuals that over deltoid it, right? Where they start lifting with the delt is not really designed to be lifting in that patterning at that point. So the trap has to help out and come into here. Now, let's say we're not just referencing, hey, my traps are really tight in the overhead. They're really tight at all times when I'm in this position or anything like that. So this position is what we call kyphosis. So when we're in kyphosis like this, my trap is going to be the thing stabilizing my scapula now moving forward, because my rhomboids have now been elongated in this position and they can't stabilize the medial border of it. So they give up, and now the upper trap takes over because the low mid trap and rhomboids, the middle of your back, just can't really support that area anymore. So what I would say, and how would I get rid of some of this? The first thing I would do is probably inhibit them, which is going to be painful, and I'm sorry ahead of time. But do some sort of self-massage in the area and then go to work some sort of rowing pattern where you're really ensuring that you're pulling with the back and not necessarily the bicep or delt or upper trap. And you're really focusing on pulling with in between your shoulder blades and causing the shoulder blade to swing around the rib cage again. Emphasizing rhomboid or lower trap development is a great way to start to turn off upper trap. I would also be careful and take a look at our pec, right? So if my upper trap is over dominant, there's a good chance that my pec is really shortened in this position like this. So you might want to start self-myofascial release right in here and in the upper trap, loosen both of those, and then emphasize getting rid of some of that kyphosis.
Man, Nick, I felt my posture improving the more you were talking.
See that?
Kyle, anything to add?
Yeah, absolutely. I mean, Dave, you just kind of made a point there. Awareness is one of the biggest things, just being honestly aware of where you are. I think every single one of us listening here, as soon as someone mentions posture, we all just kind of set ourselves up just a little bit. It's in just being there. When I have the wall back here behind me, lower this a little bit. So an easy trick I do, I'll adjust the head thing. So if you stand at a wall with your butt touching the wall and your heels touching the wall, be in your normal position, just kind of see how you feel with it. You should be able to feel your heels, your butt, your shoulder blades, and the back of your head be able to get on that wall. That's how you know you're up nice and straight. So if you're in that position, you're way far forward like this, you're going to want to get that head back, keep that chin down, make the double chin none of us want to have, and hold it right there. And what you can actually do is just very gently press your head back into the wall to activate some of those muscles that can help work to keep that head and back.
Hey, Kyle and Nick. Nick, do you mind standing sideways just so the people at home can see what Kyle's talking about from the side?
Okay. Yeah, so Nick's got the side view. So he's just pushing his head back as he goes back into that wall. And of course, there'd be a wall there kind of blocking him. If that's too much or if that's a little complicated to get, another easy one is just laying on the floor on your back with your knees bent and just kind of feeling your position. That'll automatically put everything flat on the floor. It's also in what's called a gravity eliminated position, meaning gravity is going down and your body is this way. So gravity doesn't have as much of an effect on those muscles. And again, just simply pushing your head back into the floor moderately hard, not as hard as you can, just to activate those muscles.
Awesome job, guys. Next question, I think, is geared a little more towards Nick. So Nick, I'm going to ask you directly. We have a question on sidearm throwing versus overhead throwing for pitchers. Is one more beneficial than the other? Does one create more velocity than the other? Is one safer for your shoulder than the other? And what do you recommend as a coach of these athletes?
Sure. So you're not going to typically see somebody switch, like as the coach, I'm not necessarily going to switch somebody down to sidearm unless it's a move that they feel very comfortable that they want to make. In reference to sidearm pitching is really the same thing. So if you take a look here at the position I'm in with my shoulder, this would be me being what's considered an overhand delivery or three-quarter delivery, right? This would be directly overhead, three-quarter. And then when you take sidearm, all you're really doing is changing the posture like this. So it's really a similar type action. You definitely throw harder from an overhead position. We don't tend to see a lot of high velocity throwers that are throwing from submarine or below sidearm. Obviously, there are freaks in this world that can still throw 100 miles an hour from 90 degrees. But yes, so generally, I don't see that there is one way that is safer rather than others. Really, that's about sequencing and timing and intent. So if all of that is in sync, they're both going to be equally as safe and dangerous. But really, you're not going to move somebody down to sidearm if you're interested in velocity. You're going to move them there if chances are the reason you're moving them there is that they can't get an accurate spin efficiency off of a ball going at the overhead position. They might have a better shot of doing it from sidearm.
I'll piggyback a little bit off that in terms of the injury. One of the things we're seeing a huge, really almost an epidemic of in baseball is a lot of UCL and ligament damage there from a lot of the overhead pitching.
That's the Tommy John, right?
That's the Tommy John. Yeah, it's the one that everybody knows. That's the one Justin Verlander is going to have done if anybody follows baseball. We don't see, honestly, as much of that if you look at studies from some of the Eastern countries, Japan and Korea, where they do tend to have more submarine or sidearm throwers. But that's not to say it's safer because they just have different injuries than we do. So each one comes with a calculated risk to it. And Nick said it's more about the performance that you get from it and then training it so that you can avoid those injuries.
Awesome, guys. Louisa has a question. Kyle, I'm going to direct this one to you to start, and then Nick, feel free to chime in if you have anything to add. Any suggestions or exercises for swimmer shoulder? Louisa's having some pain at the recovery phase when her shoulder's high.
Got it. That's a great question, Louisa. Swimmer shoulder is something we see a lot of as well. It still breaks down to that same fundamentals of the rotator cuff. And whether it's a baseball pitcher or a swimmer, you're going through that same motion literally hundreds and then thousands of times over and over and over the course of weeks, months, and years. It's going to be those same muscles that are going to be over dominant in the swim. Depends on which stroke you're doing that you're going to see which muscle. And those rotator cuff muscles are primarily going to be weaker relative to those big ones. So two things with that. Number one is that bulletproof rotator cuff, make it nice and strong and do a lot of those exercises with the rotations to help out with that. And number two is, again, like we were talking about earlier, you want to get into those positions of that overhead position. If that's the thing that's bothering you, you want to get into that position and strengthen it up there so that it is able to maintain that strength.
Nick, any thoughts on top of that with Kyle?
Yeah, so we don't typically see a lot of swimmer shoulder, but what we do obviously handle is a ton of discomfort from a baseball athlete or a tennis athlete in terms of getting into the overhead position. Rotator cuff is absolutely important. We do need to remember that there are 17 muscles inclusive of those 4 that are controlling the movement of the scapula. So what that actually means is, I'm not saying that you need to go and develop all 17, but a lot of times it comes down to timing. So one muscle is not firing accurately as you're going into this position. And that could be why the humeral head is gliding superiorly or anteriorly and giving you some of that impingement or uncomfortable pain as you're moving through that action. My suggestion and what we love here is isometrics. I think they're underappreciated. I think they're, especially for the shoulder, when you can get your arm into a position overhead, especially if you're in pain, without pain getting there and figuring out how to hold it there for a length of 30 seconds to 45 seconds, you are going to strengthen that movement pattern, that sequencing pattern in a way better fashion for the next time you have to go and do that endeavor.
And Nick, we have a couple extra minutes right now. Do you mind I'm sure there's some people at home that aren't familiar with isometric exercises.
Sure.
If you have a second, do you mind demonstrating just a couple, maybe you and Kyle together, that you would do for an overhead athlete, a swimmer, a golfer, tennis player?
Yeah. So you have very specific, you have what's called your upward rotators and then your downward rotators, right? So your upward rotator of the actual scapula, right? You have your serratus, which is the musculature that's wrapping right over here across the rib cage. We have our lower trap, we have our upper trap, and they work to take that scap and spin it upwards. So some of the exercises we love would be a hinged pattern like this, because most of our sport is not played standing perfectly upright and down like this, right? So we take them into a hinge pattern and then raise the arm into that upward rotation. Now in this, isometrics simply means I'm creating muscular tension without changing length. So I'm in this position and I'm no longer going to change the length of the muscle, meaning that I'm going to hold it right here for any length of time that I see fit. Now, this is one action I can do. If I want to bias external rotation, I bend at the elbow and bring it up, and I can hold right there in that same pattern. If I want to bias internal rotation, I hold right here and push down without dumping my shoulder forward, and I can bias that position. So really it's about getting into the actions you're hoping to complete and then holding in that position for a significant length of time. I wouldn't say that you necessarily need to add load right away to them either, right? Don't be in a rush to grab a band and ISO with the band. Don't be in a rush to grab a dumbbell and ISO with a dumbbell. Anybody who's anybody that can tell you how to do a low trap raise and hold it for 45 seconds, I challenge you to be able to do that with just your arm before needing any other piece of equipment.
It's really well said, and I totally agree with you. One of the hardest exercises, and it looks so simple.
So simple.
All right, guys, we're going to wrap this up. But before we do, Nick and Kyle, I would love to ask you guys both a question. What's your one piece of advice for an overhead athlete to keep their shoulder nice and healthy. Kyle, you can go first.
Wow, one piece of advice.
Like prime piece of advice.
Listen to your body. You know, our bodies are smart. They tell us things. They tell us when they're hungry. They tell us when we need to rest. They tell us when we're thirsty. If something feels off or doesn't feel right, listen to it. Talk to somebody like us or like a coach who knows what to look for, and investigate it from there.
Awesome. And how about you, Nick?
Move more. The worst posture is the posture you're always in. So the more we are moving, the more active we are with the joint, the more we vary the speeds at which we use the joint. So not always throwing an object, it's crawling, it's doing other activities with the arm in that space. The more we move, the more we complete those actions, the more we challenge the human body, the better apt it is to respond the way we want it to in sport.
Thanks so much, guys. That was such valuable information. Thank you all for joining us. We hope today's talk was valuable and you learned how to properly perform a few common exercises, as well as progress and regress them if necessary. If we didn't get to your question, we'll do our best to reach out to you directly afterward. We'll also be sending a handout of exercises for you to have as a reference. So just as you can see up on the screen, we have Nick and Kyle. We have both their contact information. You can see Nick's emails at the bottom, nick@athleteswarehouse.com, and Kyle's, kstupi@spearcenter.com. Please reach out to them with any questions you have from the talk today, or if you'd like to set up an evaluation with either of them for any condition. Myself and Michelle, our emails are on there as well. If you have any questions, if you'd like to book an appointment with us, please feel free to reach out. We'd be happy to help get you set up with one of our coaches or one of our physical therapists. As an orthopedic outpatient physical therapy practice, we treat an array of conditions from head to toe, and we're open for both in-person visits and telehealth sessions. Athletes Warehouse is also open to offer both in-person and remote sports performance evaluations. Should you feel that you could benefit from some individualized guidance and treatment, please don't hesitate to reach out to any one of us individually, and we'll personally coordinate you being set up with one of our team members for an evaluation or a sports performance evaluation with our coaches at Athletes Warehouse. Thank you so much for spending time with us today. We hope you enjoyed our webinar. We wish you all the best. Be well.
Thank you.